So, what is the difference between intoxication and poisoning? Intoxication is associated with any chemical, that is toxicity associated with any chemical, and poisoning, which is clinical toxicity. It means it is the secondary to the to accidental exposure of any chemical. Means when we take any compound intentionally, but instead of showing its actual effect, it shows some adverse effects, which is poisoning. And intoxication, suppose one takes uh, some toxic compound to get oneself killed or for suicidal purposes. Okay, if any person comes with the complaint of chest pain, then what would be your primary investigation? So the cardiopulmonary examination would be best for that person. So it involves in exact contents will vary depending on the complaint, but complete cardiopulmonary examination, which would be involving cardio, which means heart related all parameters, pulmonary related with lungs related all parameters, then belly, blood vessels. These are mainly four organs which has to be completely analyzed in cardiopulmonary examination. Next one is hemoperfusion. What hemoperfusion means, it is the technique used for the treatment of poisoning, which was in practice since 1970s and 1980s, which involves filtering the blood outside the body to remove that particular toxin substances. How it works? It works in this technique, the anticoagulated blood is that blood has to be passed through the column which contains activated charcoal or resin particles, which will suppose if that column has activated charcoal, then that charcoal which will absorb toxin substances on its surface, so the toxins will be removed and filtered blood will again be passed through patient's body through veins, not from the artery. Okay, next one. uh, can the question is, can we administer activated charcoal in the treatment of iron, methanol and ethanol poisoning? So the answer is no, we cannot, because the iron, methanol and ethanol not easily absorbed by activated charcoal. As we know, activated charcoal works on the principle of physical adsorption, on which on its surface the toxin must get adsorbed. So there would be other methods to treat this poisoning. We'll see this in next time.